We have two nurse paralegals at our office. And why? Because people become disabled for so many different reasons. There are some typical reasons and some atypical reasons. Some typical cases that we see here. Cancer. I mean, if you just think about the population, what are some of the problems that you hear about day in and day out? You hear about cancer. You hear about multiple sclerosis. You hear about Parkinson's disease. You hear about neurological disorders like those. We see a lot of those cases. Some people that have MS, multiple sclerosis, work for years after following a diagnosis and finally get to the place where they have to stop. Typically, they are not able to return to the workplace setting after that. People that have cancer, depending on the cancer, oftentimes they can rework their occupation so they can re-enter the workplace, and those cases may not be permanent disability, but they're disability nonetheless, and the individual is entitled to their benefits. We see a lot of orthopedic claims, but typically it's not a bad back kind of case because that's usually more temporary. It would be someone who has a back condition that has gotten to the point where they cannot work anymore, the pain medication is not working, they have or had surgery, the surgery did not work, or the surgery worked but cannot return them to the workplace. A broken ankle or knee surgery, that type of thing, is typically not a case that would go to long-term disability, but occasionally it does, especially depending on what you do for a living. If you have to be on your feet all day and you broke your ankle and it's causing you significant problems, it may be that you can't return to the workplace because you have to be on your feet all day. Carpal tunnel syndrome, if that problem interferes with your ability to function in the workplace, that too. The other side of the spectrum is what we call mental illnesses. We have many, many cases that involve panic disorder, anxiety disorder, something that is treated by a psychologist or a psychiatrist but keeps you from returning to the workplace. We have some bipolar cases that we're handling in this office. I have a class action, in fact, bipolar case against Hartford right now. And bipolar is a problem that is permanent, but most people can get on the right type of medication and re-enter the workplace in some way. But the policies also have a 2-year limitation typically on what is considered mental illness. That differs policy to policy, but we have problems with cases where a person has some psychiatric problem kind of married to a physical illness, and the insurance company says, we're not going to pay you more than 2 years because you're disabled because of your depression. And I argue that she's not disabled because of her depression. She has this terrible physical problem that has completely debilitated her, demoralized her, and she's dealing with that psychologically. But it's not the depression that's disabling her, it's the physical illness. And that's the type of thing that we see, the marriage between physical and mental illness as well.